Committee to order. Stand for the invocation, please. Father, thank you for this day. Thank you for the privilege of being here. May we be attentive to one another and listen and learn, and so that we can be of service to the Cherokee people. Thank you for the way you have blessed our health system, the way that we can do what we can to enable our people to stay healthy. Thank you for this time, this segment that we get to do the business of the people. In Jesus' name, amen. Roll call, Shelley.
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski.
Here.
Keith Austin.
Here.
Danny Callison.
Here.
Julia Coates.
Here.
Sean Crittenden. Joe Deere. Rex Jordan. Johnny Kidwell. Darrell Legg.
Here.
Weston O'Fire. Joshua Sam.
Here.
Mike Shambaugh. Melvina Shotpouch. E.O. Smith.
Here.
Kendessa Teehee. Victoria Vesquez. We have a quorum.
Thank you, Shelley. Had a chance to look at the minutes. I would entertain a motion to approve the minutes. Okay, in a second. All those in favor? Any opposed? Motion passes. On to reports from the Claremore Service Unit, Mr. George Valier.
Good afternoon.
Hello, George.
First thing I'd like to do is to introduce the Claremore Indian Hospital Chief Operations Officer, Commander Carl Murray. He's come down. I'm going to start bringing him with me down here so you guys get to know another face besides mine. I apologize. My report should be there on the table. I don't know how it slipped my mind, but I realized that this morning that I hadn't sent it, so I made everybody copies of it. It has our collections. It's the regular report that we send in, that I send in every month. Couple of highlights. We've got the hospital participated in a pediatric simulation project there to in our ER to increase awareness for and the ability to take care of peds coming into the ER. Pediatrics is kind of a different beast. It's during the day it's not a problem, not an issue, because the pediatrics department's open. We can have them come down or get them over to the pediatric docs. But after hours and on weekends, the ER docs take care of them there. June 21st, we participated and held the first PACT Act meeting for us, which was partnered with the VA. We set up over at the VFW there across the expo lot. I forget the exact number of veterans they had come in, but the VA was there. They had docs there, and they were actually really, it was a successful meeting. They actually had two widows of veterans who they were able to help get full benefits from their deceased spouse that they had not been getting benefits before. So they were able to actually reach out and do some good in the community there. It was open for both native and non-native veterans, anybody in the community there. And then August the 16th, Rogers State University is having their big orientation, their Big Ten event, and we'll have registration and benefit coordinators up there to introduce themselves to all the kids that are coming in to school, give them information about the hospital. If they aren't registered yet, get them registered and bring them down to do a tour of the hospital and the emergency room, and not wait until they're sick or hurt to try to figure out how to navigate the system. So we've been doing that for the last several years, and that really works out well, and it's really well received by both the university and the students up there. Any questions?
Questions for George? Keith?
More comment than question, but
I've been a member of the advisory board for Claremore IHS for the last several years, and we just did something at the last meeting that I think this body needs to know about, and it's the restructure that body a little bit. It's made up of the 17 leaders, representatives of 17 different tribes historically, and each one's vote is equal, but there was several tribes that had chose to remove their shares from the IHS and take them back to their internal health systems. Not us, but four of them. We restructured it. It took quite a while to do it just because of the way things work, but as of right now, it has been restructured so that all those who do not have shares no longer are voting members. They're advisory members. So they no longer have a vote on the advisory council. They only have voice. So they can come, they can attend, they can speak, but they do not have a vote anymore. So it actually means all who have votes actually have a vested interest in IHS and Claremore, as it should be.
That's correct.
I know that had been an issue we'd talked about quite a bit at some point here.
Thank you, Keith, for that information. George, you mentioned, are there challenges to finding pediatric care? How many pediatricians do you have on staff?
Actually, we have 6 right now.
Do you? 6?
Yes,
Okay,
we have plenty of pediatric docs.
okay. How many pediatric dentists do you have? Do you know that?
One, yes, we had to, and we sent him off to school to be trained and specialized. We grew him from within.
Good. Those are hard to find. Those
Yes, they are. Yes, they
Pediatric
are.
dentists are a challenge, I know, in our system for staffing.
Mhm, yes, sir.
It's hard to find docs that want to really treat children, the honoring ones, anyway. Any other questions for George? Thank you, George.
Thank you.
Okay. Dr. Stephen Jones is here for Cherokee Nation Health Services.
Good afternoon.
Let's do.
Well, your report's in your packet. I think we kind of touch the same things every time, so I'm going to leave any questions till the end, but if you have any questions on that. I do want to talk about a few things that's gone on the last month, just give you some information and notification of things that are going on. So last month we went and participated, or I did, and participated with the IHS area office to recognize the employees. That's an annual awards ceremony that they have each year, and we had 22 Cherokee Nation Health individuals that were recognized at that award ceremony across our system. Public Health also had one. I'll leave that for Lisa to talk about if she'd like to. So we had quite a representation there that day. So it was a good event. The other thing I want to share with you, and I didn't get it into the packets because I didn't get my results in time. So I'm going to hand it out to you, if that's okay. Can I do that, Chair? Okay. I'll split this up. I have 2 different pieces. So split it halfway. There's that. And Sean, there's that. I got another here. So we did an internal satisfaction survey with our nurses and with our providers. And sometimes you guys ask questions about things like that, and we're all the time looking at ways that we can have people have voices into our decision-making and how things are going, and sometimes we need to hear something back. So if you look at that, those handouts, you'll notice that it's on a 1 to 5 scale, and below, at the bottom of that handout, you can see the questions that were asked. You can also see the breakdown of where the location of each one of those responses came from. Out of 160 providers, we had 147 respond, so we had really good input and participation. And then the nurses is a little bit skewed because we had not only RNs, LPNs, and nurse assistants, we also opened that up to nursing teams. So we have other support staff in that that were open to respond to that. But as you can see, the responses were overwhelmingly good. We were very happy with that, and it shows that our teams are working together and are very satisfied with how things are going and how their work environment is. So just a little something for you guys to look at and chew on a little bit. So the next thing I want to cover is orientation. I know that we're having the orientation for the new counselors coming in, and I know some of you have been part of the orientation in the past. I would encourage you, we'll have the general orientation, which I'll come to, and you'll get some a very few handouts in that. The new orientation that we do with health every time we have new counselors coming in, even if you've been here a while, please take the time to come to that. It's your time to meet our leadership one-on-one, ask questions about any department. Every department's going to be giving feedback or giving you an overview of our departments. We also, this time, we're going to add the clinic administrators to that program so that they can give an overview and a history of their clinic. They don't know that yet. If they're watching, they're hearing it for the first time right now. But they're going to have a little portion of that where they're going to get to interact with you guys, and you guys can ask questions about the clinic, about the services at that clinic, and any kind of things that you would like to know. So that's a very important time for you guys to spend with them, and we take it very seriously, and we want to make sure that we inform you the best we can. So please participate in that if you can. The last thing I want to talk about a little bit is this week, we've always had hospital week in our system, and the clinics always felt like they were kind of left out because it was always focused around activities around the hospital. So this week is Health Center Week. So we've got all kinds of events and things going on at all the clinics to kind of pull them together and recognize them, recognize the disciplines and the employees at each one of those clinics. And so each day has a theme. Today's Culture Day, so if you go out and visit one of our clinics today, you're going to see a lot of people that are in traditional culture dress. We're playing some cultural activities at our clinics, and we're feeding and trying to encourage that fellowship, not to disrupt from patient care. We're still providing all that, but we're trying to do it in a fun way to recognize them. So with that, I'll turn it over to Chair for questions.
Darrell?
Dr. Jones, Councilman Danny and I were discussing the RN situation, and we're wondering, whenever we say we're looking for RNs, does it matter if they have an associate's in RN, a BSRN? Is there a pay difference? Is there a difference in duty if there's a differential between the two degrees? And can you elaborate on that?
I don't know for sure. It depends on their experience level and what certifications they have and things of that nature that determine where they fall into that pay scale. That's not, that's something that's set out by HR in the way that they tell us what that range is. So I don't know for sure all the factors that go into that. I'm not that deep in the weeds on it. But we're all the time looking to recruit. Of course, we're coming out of this situation where COVID really escalated and changed the way a lot of nurses went to become traveling nurses. It drove the market way up because people were looking all over the country for different types of opportunities. And now things are starting to settle back down. People are wanting to come back home, and we're starting to see a lot more of those vacancies filled. So we're trying to get away from from our agency partners that we've had to help fill those vacancies. So we're seeing a change in probably the last 3 months that's starting, like we're over the hump now, and we're starting to get back to some normalcy. Yeah.
Melvina?
It's just a comment. You were saying they're having cultural day. I've been up since 6 o'clock preparing food for them.
Oh,
That is
good.
in Hydro Clinic. But what's funny is I was driving down the road and I heard a rattle in the back, and I thought, what is that? Well, I forgot to give them their pan of apple dumplings.
I can probably take those off your hands if you need somebody to take them off your hands.
Joe?
I was just wondering, they've had talks about RSV and flu coming up, that it's going to affect a lot of people 60 over. I don't know if that would be you or Lisa, on how we're going to prepare. I guess it's going to happen this winter is what they're talking about.
Yeah, we try to prepare every year based on, last numbers and projections and things like that. We have to start ordering the vaccines pretty quick. So it'll be one of those things that we'll get all of our, as much preparation as we possibly can to make those decisions on how much to order. Last year, we ended up with a lot of surplus because flu, wasn't as big a deal as what we thought it was going to be. And so we ended up with a lot of surplus on some things. But it's just a best guess every year. We don't have anything that really can nail it down and say, this is exactly what you need to do, so.
All right, will we turn that into like another drive-through opportunity, or would that be an appointment call in the
Usually we
clinic?
do that.
Yeah.
We have some drive-through clinics, and then we also have same day, if someone wants to come into the clinic and get their flu shots, we do that for them, so,
Okay.
yeah.
All right, thanks.
Danny?
Dr. Jones, many times you answer really tough questions and kind of put you on the hot seat. My comment is, I had a constituent that had a young child that broke her arm, and they were trying to get in between registration and custody and different things going on in the little girl's life. But as she broke her arm, Steve Carey and his crew stayed after work to make sure that she got her arm taken care of, and it got to be, and I sent Steve her big long thank you for what happened. And many times you get ripped for the bad things, but this is one of many times that this young lady got her arm fixed. They went above and beyond what they had to do to get it there. And I want to thank you and your staff and Steve Carey for what you guys done for her. Thank you,
Great.
sir.
Thank you very much. I appreciate the compliment. One of the things that we do try to emphasize, and I'm with our leadership and all the way down, is we are a service industry. We're here to serve the patients. So if that means you have to put a little extra in to do that, some days that's what it requires. So I'm glad to hear that, and glad to hear that message is being put into place. So we appreciate it very much.
Keith?
I noticed the surveys. Did you say they were anonymous or not?
They're anonymous.
Okay,
Yeah.
I had made that assumption, but
Yeah.
I don't remember you saying that.
Yeah, they were anonymous, and we sent them out, and with nursing leadership, sending out an email saying we're going to be doing this, please participate. And same thing with Dr. Montgomery, sent out an email asking all the providers to participate. And we got good response back, so we were very happy about that.
Yeah, that's great. And second thing was, I've been seeing in the media recently that there's pockets of COVID activity that are increasing in the United States right now. I think we're going to live with that from now for a long time. But do we know if the COVID that is circulating right now, is it putting people in the hospitals? Is it in the same way it was before? How are we handling that?
Well, I'll let Lisa talk about it if she'd like, about the public health side of it. As far as the hospital goes, we have not seen increase in the hospitalizations. I noticed this morning when I looked at the numbers that we had an uptick on the test positive rate, but we did not have an uptick on the hospitalization rate. So, we're going to have these ebb and flows with this, I do believe, and I think it's here to stay, and we're just going to have to kind of deal with it.
Thank you.
Candace?
Good afternoon, Dr. Jones. It's always good to see you. I've been receiving a lot of questions from citizens about medical transport recently. And to my awareness, would you speak to the kind of issue of medical transport, essentially if a citizen has been referred for services outside of Cherokee County, they're located in Tahlequah, kind of the approach that our health system takes in those situations?
So are you referring to like a person that's in the hospital gets transferred to another hospital? Or are you
No,
referring
no.
to a person that gets sent to Tahlequah for, say, an MRI?
Yes.
Okay.
So an individual has been referred for a surgical procedure that's not conducted within Cherokee Nation Health Systems. So they have to go to, say, Muskogee or Tulsa. Is there, can they apply for funding, say, or is there any way to help mitigate some of the costs that are associated with transport?
So there are some programs, emergency medical programs that will allow us to give money for those type of expenses. Say they have a family member that has to spend the night and take care for an overnight procedure or something of that nature. As far as transportation itself, we don't have a transportation organization because depending on the level of care that a person needs to be transported determines what kind of vehicle, what kind of expertise you have to be in that vehicle to transport that patient. So that's not something that we have within our health system that is a part of it, I guess. But we do have access to some things like the CATS and Pelican and some of those to help get patients to their appointments and back if they have transportation issues.
Yeah. I've just been getting a lot of questions lately, and in some cases, there is some help that's available, but in others, the statement has been that patients have some responsibility to share the burden of their own care as well. And Cherokee Nation does its best to try and alleviate as much as we can, but I understand also that we are serving a huge number of individuals in a variety of capacities, so that's going to limit the ability that we have to transport anybody in a lot of cases.
And there are some qualifications for that emergency medical assistance program. So, and we do administer that. I mean, if someone has an issue and they express that to us, or if one of you guys brings it to us, then we're able to see if we can qualify them and get some help that way. So we do help in that fashion as much as possible.
But an emergency certification, would that still be a possibility for something that is constant and ongoing, like dialysis treatment?
It can be, yes. It's not just specific. It's titled Emergency Medical Assistance Program, but it's not emergency care. It's emergency because you have an issue that we need to try to get you help for. So the word emergency is not just for emergent care.
Okay.
If that's what your question is.
Yeah. Thank you for clarifying that, because I think oftentimes, for someone who's outside of the medical field like myself, we might not understand how that emergency designation is being applied.
Right.
So I do appreciate that clarification. And I've been in contact with some of the members of the health system staff, and they've been providing assistance. But I thought, since I am getting so many questions, it might be good to ask them in a public forum, so that way individuals who might have some questions who are out in the community can hear some of these answers.
Yeah, and I think that program was set up years and years ago. So I don't know that, it's just retained that title for years, but I think this body set that program up many years ago, and it has retained that same title. But maybe we need to look at changing that to a different term so it's not so confusing.
Okay.
Yeah.
All right. Well, I appreciate your time today,
Yeah.
and I appreciate the time, Chair.
Okay, thank you.
Bye-bye.
Dr. Jones, your patient service advocate has access to some things that they can help with and a thing
Yeah.
like that, because, so Condesa, you can refer them to the patient service advocates, and they've got.
Yeah, patient benefit advocates are the ones who administer typically that, along with Contract Health, work together to administer that program. So, yeah, if there's anybody at a local level, each clinic has their representatives in that local area that can help with that too. So, and for you guys, if you reach out to your patient navigators that we put in place, her team can also help you navigate that and get to the person you need to get to.
Dr. Jones, I just wanted to comment on this provider satisfaction survey. I mean, that took a lot of work from somebody.
Yeah.
I just remember 5-6 years ago, some of you were on the council, we did an in-depth survey as well, and it was not easy. It was fairly complicated. The biggest thing was anonymity. The providers wanted total assurance that this could not be tracked back to me. And so as a result of that, I think we got a real honest evaluation, and participation rates, what I was impressed with is how you got most everybody to participate. But congrats, I don't know how it was done.
We had a good response, and it shows a lot of, a lot of work has gone into bringing everyone together as a whole, and I think that the survey shows that we're making
Yeah.
progress.
Sure does. Any other questions for Dr. Jones? Thank you, Dr. Jones.
Okay, thank you, guys.
From Public Health, Ms. Lisa Pivek.
Good afternoon. It's good to see all of you today, and I'm honored to be here giving the report for Public Health. Before I get started, I'd like to take the opportunity to thank all of you sitting on the council for your service to both Cherokee citizens and to your communities. It's much appreciated by all. As Dr. Jones mentioned, Public Health did receive an IHS Area Directors Award for exceptional group performance for health and wellness. So that group is the Public Health Educator Group, and some of you know your public health educators that operate in your community. If you haven't met them, it's a good time to go meet them. They do a lot of work. A lot of the report that you have in front of you is consumed by lots of activities that they do that are across the board, same in every community, but then they also do extra activities in their community unique to them. And I wanted to mention one today just to give you an example of the things that they work on besides all of the activities with WINGS and school health and Healthy Native and tobacco cessation. They also do lots of advocacy work, and they do lots of community group work. One, for instance, in your report is that our TSET, that's the Tobacco Settlement Endowment Trust, that is set up in the state of Oklahoma. We have a grant from that. And that group worked with the city of Stillwell and passed a tobacco retailer zoning ordinance, which prohibits any new business owner from selling tobacco products within 300 foot of a school or a park. So in addition to the other work they do lots of work like that. They also, if you'll look down, they helped CC Camp in Adair County distribute 11 pounds of produce to elders on one day. So they do a variety of things unique to your communities. I wanted to give recognition to that group. They work very hard, and they are the heart of what we do in public health. And that group is led by Jeff Tucker, who is the director of the Community Health Promotion. So really want to thank him and thank his staff for all of the hard work they do every day. To your question about COVID, asking the variant, I can't tell if it's BA.5 or XBB.1616. I can't tell you that. What I can tell you is that our role in infectious disease will be that role of community surveillance in the realm of wastewater surveillance. And we're developing that right now. Wastewater surveillance came about largely during COVID, but now it's being used for all kinds of other viruses and other indicators of things in your community. And what it can do is tell you weeks beforehand what's coming in your community, hopefully, and be able to tell you a little bit about it. We're in the process of trying to figure out it requires a special sequencer, and we're working through those details right now to get that sequencer set up and get all of our staff trained that work in the epidemiology department on how to run that wastewater surveillance samples and then do all the analysis of that and feed it back in time to all of our partners, obviously the health system, of what we're seeing in communities. And as we move farther into the development of that, you will see more and more things that can be deduced by looking at wastewater. So I wanted to mention that. Our FAB site visit is finally this week. COVID really put us behind, but we are very excited about this week. It's going to be a virtual site visit, which I think is a good sign, and it'll be about 4 hours, and then we'll know something in November. But I feel pretty confident. We have a good understanding of what's going to be asked, and all of our staff are ready for that. I also wanted to give a thank you to a couple more people or groups. I wanted to put a special thanks out to the WIC staff. They have been doing an excellent job on everything that they do, but in this season, they're also administering 2 different farmers markets. So there's a WIC farmers market that's funded by the USDA, and then there's a Cherokee Nation farmers market that's funded by us. And so they've been busy doing that. In addition to SEBTC program, they've been doing that this summer, signing up farmers, going to farmers markets on Saturday, and really want to give them a thank you for all that extra effort they've been putting in. And the other group that I'd like to mention today is that group from the Mills Seminary Recreation Center. COVID was very hard, as you know, on lots of programs like that, but I've been watching their numbers, and they continue to grow in members, and their visits continue to grow every month. They've got their child care numbers back up, and that is because lots of the work that they do, they're having special camps, basketball camps for kids, different times. They've got several tournaments scheduled into the future for community members in the evenings, and we're going to promote those with employees too. So wanted to thank them for the good job that they do. That's all I have. I'm happy to entertain any questions.
Questions for Lisa? Junior?
You know, on our local news and in the papers and stuff, they've been talking about tick infested in the meat. Are we having a problem with that?
You know, I couldn't tell you that for sure, but I can get with Natural Resource Environmental Health, and they can probably get that answer for you. I haven't seen anything on it, and I haven't received a HON alert with a health network alert yet, but I'll have to check into that for you.
I appreciate that. You know, I got calls, and some of the elders were concerned, and of course, I don't eat a lot of steak, but some of the other councilmen do, but I don't. But anyway, they were concerned. I told them I'd ask.
Yeah, well, good opportunity too, just for me to plug the local farmers markets and local farmers selling beef products that are grown locally and taken lots of care. So it's an opportunity to really tout that along with the farmers markets. Most of them you'll see that. But I can get an answer for you from Environmental Health or Natural Resources on that. As long as you'll promise to send me that ringtone that you had a while ago. Just kidding. Any other questions?
Lisa, you mentioned the WIC staff. Our expectant mothers, what type of WIC benefits may they be eligible for?
So once a mother becomes, or a woman expects, they can start to get onto WIC and receive benefits. As they have their child, they will receive benefits for whatever is classified. So what WIC does, and USDA sets the rules for different ages, have different food packages that they're eligible to get. Now, WIC also sponsors children up to the age of 5 in the household as well, so they have different food packages as that moves along. So if it's great to get on WIC as soon as you can when you find out you're expecting, and there's also opportunities with the Commerce Program right now that if you are a Cherokee citizen and become pregnant and join WIC and are eligible for WIC, to get involved in some of their programming to supplement the benefits that you receive from WIC, such as food packages.
So that commerce programs, were those actually some checks, cash that the expectant mothers could receive?
Well, the way that it works, it's called First Steps to Hope. And it's an 18-month program. You have to be enrolled in WIC, and you have to be expecting, and you have to be a Cherokee citizen and live within the reservation. And once you get on the program, that's a $400 cash supplement for 18 months, intended to take care of mothers and young children and help give them a hand up through that process.
Didn't the state of Oklahoma just announce a WIC endeavor like that as well, a cash incentive for expectant mothers? The state of Oklahoma just recently.
Yeah, but what we've seen since Cherokee Nation announced this initiative is we've seen our WIC population increase, which is what we want to see. We know that we don't reach near the amount of persons in our community that are eligible for WIC, that could get on WIC. Now, WIC as a Cherokee Nation program itself serves everyone, but the First Steps to Hope is for Cherokee citizens only, and the Cherokee Nation Farmers Market is for Cherokee citizens only. But
Any of those WIC programs income-based?
all the WIC programs
Are all income-based?
income-based, yeah, they are. And it's different for expecting and then in through after they have the child, what those eligibility requirements are.
Yeah.
But, we have just received a grant not that long ago that we talked about. We call it a CHOW grant, but it's a community innovation grant. And it's for the next 18 months, we're going to be doing lots of work out in the community to educate women and families about WIC, try to find women and families that are not on WIC and get them signed up, and then take a lot of feedback from our constituents about why they may not use their WIC, or why they don't stay on WIC, or why they haven't joined, so that we can improve our programs.
Thank you, Lisa.
Thanks.
Any other questions for Lisa? Okay, thank you, Lisa.
Thanks.
Okay, that's all the reports, no old business, no new business. Announcements. Anybody have some announcements? I did have the occasion, I did visit the new Joplin Dental School. Their inaugural class had 3 Cherokees in it, so it's probably going to be more than what OU admits, so I was really encouraged, but I think it just happened by accident. But they did admit 3 Cherokees. And several other counselors attended the white coat ceremony for our med school here, first-year students. That was on August the 4th. It'll be the 4th class, and then this coming May, in 9 months, we will have our first graduating class from our med school, incredibly. And hopefully next month, we'll have the medical school dean will come and give us an update on the medical school, so that'll be kind of on the calendar. Any other announcements? Well, okay, I'd entertain a motion to adjourn. All those in favor? Any opposed? We're adjourned.